Good morning, everybody. I am Dr. Namita Jaggi. I am the Director for the Labs and Infection Control, and today we are going to take a session on the infection prevention and control at Artemis, a proactive approach. As you all know, infection control and prevention is extremely important in today's world, which means that the patients who are coming to the hospital should not acquire infections other than the infection that they have come with. So today we are going to take you through a flow of presentation, which is what is infection prevention and control, the structure of infection control, the focus areas, what do we track, and how do we implement the infection prevention and control program. So what is infection prevention and control? It simply means to manage, reduce the infections that may occur in the hospital and which are known as the healthcare associated infection. What is a healthcare associated infection? Any infection that is acquired by the patient in a hospital or a healthcare facility in whom the infection was not present or incubating at the time of admission. It also includes the infections which the staff or the visitors can acquire. So therefore we say that the patient should not acquire a healthcare associated infection, the staff should not acquire, and the visitors should also not acquire any infection from the hospital. Unfortunately, healthcare associated infections are a reality of today. Why? Because there is decreased immunity in the patients, because we have an increasing variety of medical procedures and invasive techniques, that is, medical practice is becoming more invasive these days. We are creating a lot of tracts into the body through which the bacteria can enter the body. And there are also a lot of multi-drug resistant bugs abounding everywhere in the hospital. The hospital is full of sick patients from whom you can acquire the infection. What is the magnitude of the problem? In developing countries, the magnitude of problem is more. It can be 10%. In India, sometimes it is reported to be as high as 20 to 30%. In the developed countries, it is as low as sometimes 5%. You'll be happy to know that in Artemis, we have a very low infection rate, less than 2% sometimes, or a little more than that, but never coming up to 5%, which is a very good thing because of our good infection prevention and control program. What is the impact of healthcare associated infections? It not only has an impact on the patient, it has an impact on the community as well as the hospital. For the patient, if a complication like healthcare associated infection occurs, the patient has to stay for longer in the hospital. There is more morbidity, there is more mortality, the length of stay increases, and above all, there is a lot of emotional stress to the patient, also the cost increases. If you talk about the hospital, it gives the hospital a bad name. People say, let us not get a surgery done at that hospital because we have infections after the surgery. It erodes the bottom line, the revenue of the hospital, because the longer the patient stays, the more are the costs, and therefore we don't have a rapid turnover of the patient. Litigation. Sometimes patients may have litigation against the hospital. Sometimes they may hound the CEO of the hospital for some discounts. And above all, in today's time, for the accreditation purposes, whether it is JCI or whether it is NABH, there are very important chapters. In NABH, we have the HIC, the Hospital Infection Control chapter, and in JCI, we have the Prevention and Control of Infections, which is a huge chapter dedicated to infection prevention and control. Now we come on to the next thing. So why is infection control extremely important today? Because of patient safety. Utmost important is the patient safety because of accreditation, because of the image of the hospital. The insurance agencies, the insurance is not going to pay for the healthcare associated infections going forward. In the US, it has already stopped paying for the healthcare associated infections. The bottom line of the hospital, to avoid litigation and to have a very healthy staff in the hospital. It impacts all the specialities of the hospital, whether it includes critical care or medicine or gastroenterology, surgery, pediatrics, ENT, everything in the hospital is impacted by the healthcare associated infection. And it impacts all the device usage and surgeries, whether it is a catheter associated UTI, whether it is a central line associated bloodstream infection, whether it is a surgical site infection, or whether it is a ventilator associated pneumonia. Also, we have a lot of antibiotic resistant superbugs in the environment. You should just be aware of the names. It could be MRSA, It could be CRE, which means carbapenem resistant enterobacteriaceae. It could be vancomycin resistant enterococci. It could be the MDR soot, multi-drug resistant soot, and the antibiotic resistant bacteria cause infections which are very difficult to treat. Now we come to why do healthcare associated infections occur, and we must understand the chain of infection. So you have an infectious agent which could be either a patient or an environment or the staff which is carrying the bacteria on it. There has to be a portal of exit. Usually it is the hands of the healthcare worker which touch one area and then transmit it to the other susceptible host, which could be any other patient or a staff. And what are the portals of entry? It could be a catheter, it could be a ventilator, it could be a surgery, and that is how the tracts are created to enter into the body and the infection is transmitted. So we have to break the chain of infections. So can we do something to reduce the HAI? Yes, definitely. Almost 1/3 of the HAIs are preventable, and we have zero tolerance for HAI. Let's start right at the beginning. All of you must know this lady. Her name is Florence Nightingale, the lady with the lamp. What did she first say? She said the very first requirement in a hospital is that it should do no harm. And the second gentleman is Ignaz Philipp Semmelweis, who is the father of hand hygiene. He was an Austrian and he first advocated the use of a chlorine solution to clean the hands of healthcare workers so as to avoid the transmission of infection through the hands of healthcare workers. How do we achieve this in the hospital? By means of a robust, effective, and comprehensive infection prevention and control program in the organization. What is the goal of the IPC program? The goal is to identify and reduce the risks of acquiring and transmitting infections among the patient, the staff, and the visitors. It is managed by the infection control organizations in the hospital, which could be a multidisciplinary infection control committee, or it could be a smaller infection control team for the day-to-day functioning, which comprises of an infection control nurse and the infection control officer, who is usually a microbiologist. At Artemis Hospital, I am the infection control officer, and we have a group of infection control nurses. What are the components of the infection prevention and control program? First and foremost, and most importantly, it is the management support. Without management support, we cannot achieve anything because they are the providers of the resources, that means manpower and all the consumables required for infection prevention and control. Then it is about the infection control organization. It is a team effort. All the clinical heads, the head of departments in the hospital must lead this program. We have an infection control plan, and then we find out very innovative ways to implement this infection control program. This is our senior management, and they provide us the resources which are required for the infection prevention and control. The infection control organogram is the Artemis management, after which is the committee, after which is the team, after which are the infection control team leaders, who are the nursing team leaders in the various areas who also look after infection prevention, and then are the head of departments, the doctors, and we should not forget the patients, because patients are also our partners in infection prevention and control. The Infection Control Organization is a multidisciplinary committee which meets quarterly and discusses various matters. This has representation from across the hospital, whether it's physicians, surgeons, nursing, food and beverage, the engineering, the housekeeping, etc. And the infection control team, which has the infection control officer and the infection control nurses for the day-to-day functioning of this program. Infection control team leaders are certain individuals who are deputed to work as the messengers for infection prevention and control in their various areas. Also, it is a shared responsibility. The hospital-acquired infection is still perceived as a problem for the infection control team alone, and not enough staff accept responsibility for the same. This is a very important line, and we should follow this in our hospital. So this slide shows you that every department is involved in the infection prevention and control program, including the top management. Clinical leaders should lead by example. If they are doing the right thing as far as infection prevention and control is concerned, their whole staff or their whole department will follow them. Now we come to the infection control plan. So when a hospital is being commissioned, we have certain areas which we should focus on, that is during construction. And now we have another building coming up and we will do the same process again. And then after that, moving forward, we have a mnemonic which is known as SMART, which is S stands for surveillance, M stands for monitoring and auditing, A stands for the antibiotic policy, R is the reporting and the isolation of diseases, T stands for training and staff health, and otherwise if we have an outbreak, then we have another investigation plan to follow. What are the focus areas of infection prevention and control? Normally, the key areas which we consider in infection prevention are the sterilization, disinfection, the antimicrobial stewardship, the standard precautions, the transmission-based precaution, the training, the visitor policy, immunization, follow-up of needle stick injuries, etc. We have 12 elements of standard precaution, which you can see in this slide: hand hygiene, gloves, mask and eye protection, respiratory etiquette, clean environment, clinical waste, patient care equipment, linen, management of body fluid spills, how you place the patients in the hospital with adequate distance between them, and preventing exposure to the blood and the body fluids. Out of this, we all realize that hand hygiene is the simplest and most effective measure to prevent infections, because the infections are transmitted by our 10 fingers. And we must realize that if between patients we want to do hand hygiene, alcohol hand rub is the fastest, easiest and most effective measure. Sometimes we have to wash our hands with soap and water. And when is that? After visiting the restroom, before eating, or when our hands are visibly soiled, then we must use soap and water. All other times, the CDC has recommended the use of alcohol hand rub. Now we come to the 5 moments of hand hygiene. Hand hygiene, as we know, is an extremely important measure to prevent healthcare associated infections. There are 5 moments. These posters are displayed all across the hospital. We will go over the moments one by one. The first moment is before touching a patient. The second is before any clean or aseptic procedure. The third one is after body fluid exposure risk. The fourth is after touching a patient. And the fifth one, which is the most important, is after touching the patient's surroundings, which we often forget. Why are these 5 moments placed like this? Because these are the times when we may get infection in our hands and can transmit it to another person. So therefore, at these times, we must be very careful. The next slide tells you about the steps of hand hygiene, how to hand rub and how to hand wash. I often say that please do not fret about the sequence or about the number of the hand hygiene steps. There are 8 hand hygiene steps, but the idea of all this is to make sure that all the areas of your hand are clean by either soap and water or by the alcohol-based hand rub. These charts are also displayed and you could look at them on the website or in the posters displayed in the hospital. Always remember, gloves are not a substitute for hand hygiene. It doesn't mean that if we are wearing gloves, we can avoid hand hygiene. This is a little busy slide. It talks about the transmission-based precautions. We talked about the 12 elements of standard precaution. Those precautions are the precautions which we must use in every patient entering the hospital. That is why they are known as standard precautions. And they originated because we had patients with HIV. We used to earlier call them universal precautions, and now we call them standard precautions. But transmission-based precautions are those for special conditions. That means for those diseases or the bacterial diseases which are transmitted through air. What are they known as? Airborne precautions. There are 3 important diseases which are transmitted by air: tuberculosis, measles, chickenpox, or herpes zoster, which is also like the chickenpox only. Now these conditions, the viruses or the bacteria remain suspended in the air, and therefore we must have the negative pressure rooms where nothing can come into the room through the air. We also require N95 masks for those people who are caring for these patients. We have contact precautions for those conditions which are transmitted by contact. So you have the personal protective equipment like the gloves, the gown, and of course hand hygiene, cleaning and disinfection of the environment. And then we have the droplet precautions for those bacterial diseases where the droplets fall to the ground or to the surfaces after a distance of about 3 feet. H1N1, all the other viral diseases come under this category. So for the H1N1, we may not require a negative pressure room or N95 mask at all times. Even a surgical mask would do. Next, we come to the biomedical waste management. We all know that the biomedical waste management segregation is an extremely important thing. We have charts again put all across the hospital. The recent guidelines have had certain changes which are incorporated according to this slide, and you can have access to this whenever you wish. So we have a red bag, a yellow bag, a black bag, and a cardboard boxes with blue marking, and then the sharp containers. We must understand that the infected plastics as a group has to go into the red bag. The yellow bag has the anatomical waste, the OT sponge cloths, the caps and the masks, the soiled with anything which is soiled with the blood, the ECG electrode, soiled linen, blood bags. The black bag is for general waste. We have discarded medicine and cytotoxic waste in the yellow bag with the symbol, with the cytotoxic symbol. Then we have the sharp containers. All the sharps must be put into the sharp containers and not into the bags because they can cause needle stick injuries to the housekeeping personnel or the GDAs. And then we have the blue cardboard boxes where you have to put the slides, the empty vials, the bottles, etc. Now we come on to a very important aspect, which is environmental cleaning. If your environment is not clean, you can pick up germs from the environment. We have divided the hospital into 3 areas, that is the high risk areas, the medium risk areas, and the low risk areas. All this information is available in an infection control manual, which is accessible to all of you in the common pool, or you can contact the infection control department. The team leader in the nursing areas are responsible for getting the cleaning done through the GDAs and the housekeeping. Why we have divided the area into these 3 of the hospital is this, that certain low risk areas require less frequency of cleaning, whereas the high risk areas like the critical areas like ICUs and OT require a higher frequency of cleaning. We have hospital approved disinfectants which is also available in the manual, and the infection control personnel also know about it. Now we come to the spillage management. We have a lot of spillages like the blood and the body fluid spillages, the cytotoxic drug spillages, chemical spillages, mercury, though we are a mercury free hospital, but 1 odd could be there in the hospital, and the radioactive material spillages. The contact number is 7845. The chemical which is used for the blood and body fluid spillage management is 1% hypochlorite. It has to be freshly prepared because the stability of this compound is only for 24 hours. The process is explained in the manual. We have to keep the sponges or the papers which are immersed in 1% hypochlorite for at least half an hour, and then we have to discard them. But for us, we have to call 7845 wherever a spillage occurs. Needle stick injuries. We are dealing with needle stick injuries day in and day out because we are dealing with needles. What do we do when we get a needle stick injury? First and foremost, we must wash the area. Then we must inform our team leader, fill out the incident report, and rush to the emergency. We have a very nice post-exposure prophylaxis program in Artemis, as well as a pre-exposure prophylaxis program, which all the employees are told about at the time of induction. If you have any issues or any questions, you can contact the infection control department for it. We give the hepatitis B vaccination as a prophylaxis to all new joinees on Monday. We know that there are 3 doses for the hepatitis B vaccination. We have it at the time of joining, then after 1 month, and after 6 months. On every first and third Wednesday of every month, the OPD nursing station timings are 2 to 4 p.m. We must complete our immunization. The onus is on us. Of course, the infection control personnel and the HR will help you to achieve your 3 doses. After that, you have a protective titer of antibodies, and if God forbid you get a needle stick injury with a person who is infected with hepatitis B, you will have a protective titer and you will have no harm. What are we tracking in the hospital as a department? This is just for your knowledge, and you should understand what the infection control department does. So we track the overall healthcare associated infection, then we track the rates of certain device associated infection like the catheter associated urinary tract infection, the central line associated bloodstream infection, and the ventilator associated pneumonia. Also, we look at the surgical site infection after a surgery. What are the chances of infection that we have after a particular surgery? We also look at the hand hygiene compliance, and we do regular monitoring and auditing of a variety of things like hand hygiene technique, the safe injection practices, the personal protective equipment usage, the linen and laundry, the biomedical waste management segregation, the kitchen audits, and the device associated infection checklist compliance. Antimicrobial stewardship is a very important component of patient safety today. Antibiotics are being used indiscriminately, and because of that we have a lot of resistance and we don't have any antibiotics left to treat the infections. We have an antibiotic policy at Artemis which includes the pre-surgical, the empiric, and the reserve antibiotics. We have the implementation of the reserve antibiotic form which is incorporated into the EHIS, and the person cannot order for a reserve antibiotic until and unless he fills that form. We have a dedicated pharmacologist support, we release the antibiogram 6 monthly, and we have an antibiotic guidebook for the clinicians. We have released the antibiotic guidebook with the help of our CEO, Dr. Devlina, and we do a variety of measures to control and manage the antibiotics in the hospitals. How do we implement the infection prevention and control? Up till now, we were talking about the structure of the program. Now, how do we implement? We implement by increasing the awareness. We have a variety of innovative techniques. We encourage and support and celebrate the infection prevention and control events. We have a lot of team spirit, and above all, we have started involving the patients by giving them patient education. We have a lot of awareness in the hospital created through CMEs, the continuing medical education, on many important topics. These are some of them which are shown on this slide. We have a lot of innovations like the best poster, the best slogan, we have hand hygiene dances, we have a fashion show based on biomedical waste management. Every year on 5th of May we celebrate the hand hygiene day, and we have a different theme each year to celebrate that and to make the message of hand hygiene reach each and every member of the staff. We provide a lot of encouragement to our staff in terms of awards given to them when they perform something good in infection prevention and control. This slide shows the time when we won the WHO Hand Hygiene Excellence Award in 2010-2011. Our hospital was the first hospital in India to win it, and then for a large time there was no other hospital. Only this year another hospital has won this award. This was all because of good teamwork in the hospital. These slides show the hand hygiene celebration since 2008. Every year we had a different theme, whether we had a big teddy bear into the hospital, whether we had hand cutouts to say, I commit to hand hygiene. The senior management, Dr. Devlina and others have actively participated in this program. This was the hand hygiene celebrations in 2016 when we had a special system to see what are the bugs which are in a hand due to some ultraviolet light. And then in 2017, we had the patients as partners in infection prevention and control. It was a hugely successful program where we went to the patient care areas and had short plays, skits and interaction with the patients. This is about the award which we had won, and the infection control nurse and myself, we had gone to Australia to receive this award again because of teamwork. This is the Hero of Infection Prevention Award which was available in 2012, and then we had the Society of Healthcare Epidemiology International Ambassador Award in 2015. Involvement of patients is a very important component of infection prevention and control. This particular slide shows you a chart which was prepared by one of our staff members who was in the pharmacy department, I think in 2008-2009, very early, and we have preserved it. And it's read, "Thank you doctor for washing your hands before touching me." Patients are a very crucial component in infection prevention and control now. We have had several programs with patients over the past few years. So what I want to tell you is this is a very small capsule which has been presented before you. You could please read the manual or come to infection control department. Infection prevention and control is absolutely important for all of us, and infection prevention is in your hands. So please remember this. Thank you very much for a patient listening.